Do you have any side effects due to chemotherapy, doctor?
Yes, all treatment has side effects. Yes, chemotherapy definitely has side effects. The important thing is, if it is properly given by an experienced chemotherapist, side effects are manageable, tolerable, and acceptable. Mainly, hair loss is one of the main side effects of chemotherapy. At the moment, it's difficult to avoid hair loss. Second and most important side effect is the depression of the bone marrow. As you all aware, bone marrow forms the white cells, red cells, and platelets. So when you give chemotherapy, there is depression of the white cell formation, red cell formation, and platelet formation. Because of white cell depression, you get what we call neutropenia, which results in infection. So higher chance of developing infection if you have a neutropenia or low white cell count. By affecting the red cells, it causes anemia. So you may have to give blood or blood stimulating hormones. Can affect platelet formation. So that way it can lead to bleeding tendency from the gums, nose, or from other parts of the body. So you will have to give platelets only, counteract the side effects of low platelets. So this is the side effect on the bone marrow. But nowadays there are drugs available which will prevent neutropenia. We call it colony stimulating factors, which will be given prophylactically after the chemotherapy. It will stimulate the marrow and doesn't produce neutropenia, thereby avoiding infection. Third important side effect is the gastrointestinal tract, alimentary tract. There is inflammation of the entire mouth, food pipe, stomach, and large bowel. So they may develop sore mouth, vomiting, loose stools. Here again, with adjustment of dosage and prophylactic treatment, you can prevent this soreness of mouth and diarrhea and dysentery. That's why we advise the patients to have a soft and bland food, not much of chilies or spicy food. Fourth side effect is common, especially affecting the younger people, is their fertility. Can affect the testes as well as the ovaries. Elderly people, it's not a concern, but in young people who are not yet married or not yet children, it's a main side effect. Here again, we try to protect the ovaries as well as testes by hormone blockade and preventing infertility. So these are the four main side effects: hair loss, alimentary tract involvement, bone marrow depression, and infertility. There are other side effects which are not so common, but in general, if chemotherapy is properly administered, it is acceptable and tolerable. And majority of the side effects are reversible. They will get back their hair, they will get back the normal marrow, and they will get back their alimentary tract system normally after some time. So it's not a painful procedure, but there are side effects.
Okay. Whom should one consult if they have any of the symptoms discussed, doctor?
Beg your pardon?
Whom should one consult if they have any of the above symptoms discussed? Which doctor or where they should go?
You mean after chemotherapy?
No. After diagnosis or if they have any symptoms.
Right. Now, usually, you should go to an oncologist. There are three branches of oncologist, mainly surgical oncologist, radiation oncologist, medical oncologist. Preferably, you should go to a medical oncologist because they are physicians. They take care of other systems also, not only the breast, but also other systems. They assess the individual. So First, it's a clinical examination. The doctor examines the breast and other systems and find out what it is. If he thinks that it is a lump, an abnormal one, then he will ask for certain tests. The first test will be mammogram. It's a simple screening test, painless test, easy one that will give us some information about the nature of the lump, whether it is cancerous or non-cancerous. But ultimately, a simple needle biopsy, that will be the one that will confirm the diagnosis, whether it is cancer or non-cancer. So this is the first step. Clinical exam, mammogram, and biopsy. So we establish the diagnosis of cancer. The second step, to find out the stage of the disease. So whether it is confined only to the breast, or it has gone to the armpit, or it has gone to other parts of the body. Then we will do ultrasound examination of the abdomen, or a CT chest, or a PET scan. PET scan nowadays covers the entire body. It will, from head to foot, it will give us the information whether the disease has spread to other parts of the body. So we can easily make out whether the disease is stage 1, 2, 3, or 4 by doing this one test, PET scan. PET scan is a very important test. Luckily, in India, it's freely available in major cities and it's affordable. Whereas the PET scan in America costs 3 lakhs, whereas in India, we can do it for 25,000. So it's a boon for cancer patients that we can diagnose and stage the patient. So once we diagnose and then stage the patient, then the treatment is planned depending on the stage, the biology, and the affordability. You choose the treatment. So this is how a patient with a breast lump proceed with proper investigation. Preferably go to a medical oncologist.
Okay, thank you, doctor. Is ovarian cancer related to breast cancer, doctor?
Yes, ovarian cancer also is a hormonal related cancer. And I have already mentioned the BRCA gene, the tumor suppressor gene of the breast cancer and ovarian cancer. If it is mutated, then they develop ovarian cancer. So it's familial, but then there are other factors, lifestyle factors, which are responsible for ovarian cancer. Just like breast cancer, overweight, excess consumption of animal fat and protein, diabetes, alcohol, smoking, they all play a role in the formation of ovarian cancer. So to some extent, it is related to breast cancer, because if the ovary is the site of estrogen production, so if ovaries can be removed, you don't develop breast cancer. And another feature is breast cancer occasionally spreads to ovaries also. If it spreads to the abdomen, sometimes it spreads to the ovary. So this way, ovarian cancer and breast cancer are related and involved.
Okay, thank you, doctor. Can breast cancer spread from person to person, doctor? This is the most common myth everyone has.
Breast cancer?
Can breast cancer spread from person to person? Is it contagious?
No, it is not at all a contagious disease. It is caused by mutation, and therefore it is not an infection. It is not contagious. It's a lifestyle disease or a familial disease. Nothing to worry about.
Okay. So the final important question is breast cancer treatment expensive, doctor?
Breast cancer treatment?
Expensive. How costly is the treatment?
Unfortunately, it is expensive. The drugs are expensive. Surgery also is nowadays expensive. Radiation, we have fine-tuning methods of radiation, which are also expensive. On an average, anywhere from 3 to 6 lakhs will be required for the treatment of breast cancer. Therefore, I would advise all of them to go for insurance, medical insurance, because nobody knows when a person is going to develop breast cancer. So it's better that you have a medical insurance for 4 to 5 lakhs. Also helps in tax deduction. So everyone should go for a medical insurance.
Okay, doctor. And is mammogram the only way to diagnose breast cancer, doctor? Or are there any other investigations other than mammogram?
Mammogram is the commonest method of diagnosis of breast cancer. There are many ways of doing mammogram: ultrasound mammogram, thermal mammogram, X-ray mammogram, MRI mammogram. So mammogram is the best method. Clinical exam can detect lumps the size of 1 centimeter or a little more, whereas mammogram can pick up to 3 or 4 millimeters. So very early diagnosis is possible with mammogram. So mammogram nowadays in the West, they don't do mastectomy, they just do only a lumpectomy. So that's the advantage. So mammogram is the best method of screening. So all women after the age of 40 should go for mammogram. With the family history, they should go for mammogram at the age of 30.
So do we have any special screening for women with dense breast, doctor?
Yes, dense breast is a bit difficult to make out small lumps. There you go for MRI mammogram, easy to pick up. And the thermal mammogram is another screening device which can pick up small lesions in the dense breast.
Okay. I am done with my questions, doctor. Any final note you want to say, sir?
Now, breast cancer is easily preventable disease. When we say prevention, we divide them into primary prevention and secondary prevention. Secondary prevention already we have described, that is early diagnosis. Early diagnosis, once they develop, we diagnose it in the early stage. So with treatment, we don't have to lose the breast. We can completely cure the disease if we diagnose it in the early stage. Coming to primary prevention, you should lead a healthy life. Body weight should be standard. You must be fit. Physically, you should be strong. And you should avoid junk food, animal fat and animal protein. Take a lot of vegetables and fruits. It's very important. And if you give birth to children, feed them for a longer period. This way, we can prevent the formation of breast cancer. Also, avoid smoking and drinking. Better control of diabetes. This way also you reduce the incidence of breast cancer. So prevention is better than cure. So lead a healthy life.
So thanks a lot, doctor, for your valuable time. It was very informative and useful. Thank you, viewers, for participating in this breast cancer awareness live session. Spread the word. Breast cancer is curable if detected early. Don't ignore. Take action now. Thank you, doctor.
Thank you.
Thank you, doctor. Thank you.